face. Good boy.
Emmy Hall's son Jackson is still recovering after weeks fighting off a devastating bout of flu.
Is that good? Is that yummy? I went to get him dressed for school run in the morning and realised he had a bad rash from neck to toe and took him to the GP. Do you want one, Jackson?
Yeah.
Went into panic mode and definitely thought it was something more than a reaction or a viral infection. I definitely felt like there was something more going on with him.
Over a fortnight, his condition deteriorated.
Laying on the couch, lethargic, not moving, but it got worse to the point where he wouldn't even eat. He was barely drinking. He had temperatures of 39.3. I'm like, do I ring an ambulance or not? Like, you don't know.
Jackson was admitted to hospital where he had a flu test.
And it came back roughly, 12 hours later, and they come in and told us he had influenza A. I honestly didn't even give it a thought that it could be this bad. It's pretty serious.
Influenza has the potential to be very dangerous, I think, compared to some issues such as Ebola or a new strain of flu such as swine flu. People have become desensitised because it's there every year. But it is certainly a serious infection.
Notifications for influenza have skyrocketed this year, hitting almost 58,000 cases so far. That dwarfs the number of notifications normally received by this time of year. Already, 139 people have died, including a 3-year-old in Victoria and a 15-year-old girl in Adelaide.
It has been a very bad year, although technically we're still not in the flu season.
Dr Sanjaya Senanayake is one of Australia's leading infectious disease experts.
This could go two ways. We've had so many cases through this part of the year, it might actually be a milder winter with regard to flu. On the other hand, however, it might continue to escalate. We really don't know.
Depending on their age, Australians are offered 3 different vaccinations which reduce the effect of the flu virus.
There are 3 vaccines, one for very little people, 6 months to 3 years with a lower dose of vaccine, so that's recommended for those very young age group. Then for older people over 65, there's what we call a trivalent vaccine, which has got a higher dose in it, which is on the basis that as people get older, their immune response to most things, including vaccines, may not be as good as when they were younger. So we've got a higher dose in those vaccines. And for the rest of the population, there's the standard quadrivalent vaccine with 2 strains of A influenza and B influenza.
Aged care facilities like the one Star Dang runs in Sydney's north require all staff and residents to get the flu vaccine.
5 to 52.
Thankfully, we haven't had an outbreak in over 10 years now, and it's because we have very strict management protocols for outbreaks.
So hand hygiene, why is that so critical? Just cleaning your hands properly?
It's important because our staff here are touching the residents on a daily basis, and they are the portal of infection, and they can potentially spread this across to other residents. If we do identify any residents who are at potential risk, then we would try and restrict movement.
Months ahead of the flu season, the World Health Organisation decides which strain to put into the millions of vaccines that Australia receives.
It takes a while for the vaccines to be manufactured in large numbers. So really, we have to try and do it in as timely and an efficient manner as possible. So the World Health Organisation thinks that that's the best time to get together to start talking about the vaccine composition.
At another aged care facility, Holy Family Services home in Western Sydney, they're part of a rapid flu test trial. Instead of 2 days, This public health unit team can provide a result in just half an hour, potentially stopping an outbreak in its tracks.
Yep, I hear you've come down with some flu-like symptoms.
That's right.
Yep, okay, so what we're going to do is we're going to do a swab.
So what this machine is allowing us to do is within 30 minutes, while the team are at the facility, they can say, is this flu A or B? And therefore those discussions between the families, the patients and their GPs can occur quite quickly.
The diagnosis is quicker, therefore what medications they're given are quicker and potentially more effective.
Exactly.
Despite having vaccinations, 11 residents got the flu. They've survived.
If we're able to minimise the complications of flu, we're preventing deaths. We don't want residents to go to hospital. We want them to be at their home. This is their home. We want them to be with their family and their friends.
You can't predict anything with flu. We don't know whether it will be an early season that will peak, and we don't quite know what the size of the season by the end of it will be. This flu this year is no more virulent or nasty than normal, but it's just that it started a lot earlier than normal.
Health authorities are preparing for the coming months.
There is no super vaccine. There are lots of different varieties of vaccine. Some have some value over others, and we're very keen to look at all options to improve our vaccine effectiveness in this country.
The Federal Health Department says it's already released 12 million doses of vaccine. 7 million will be given free to anyone aged over 65 or under 5, to pregnant women and Indigenous people. The Health Minister's told 7:30 he's written to vaccine manufacturers requesting they produce additional flu vaccines to meet unprecedented market demand, which the government expects will be available in the coming weeks.
I had it when I was pregnant with Jackson in 2013, and I never had it again because I just thought, oh, it's a flu injection. Like, what can it do? What would it prevent? But now I'm kicking myself, and I believe that it's something that I should have got done sooner for the both of us. Maybe he wouldn't have got as bad as what he has got to.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.